Stuttering, as such called as stammering in layman terms, many a times we think that stammering cannot be treatable or it is inborn. Or they think that okay, we can manage for some time till we become adults, and when it comes to an interview or a job purpose or for marriage, then only it can be treated. But we have to identify the stuttering or stammering at much earlier stages to get it treated so that the life can be much more better, and without any hinders you can achieve much more better goals. So how can it be identified? At 4 years of child's age, the actual stuttering can be identified if at all the child is trying to find words at a particular point, or he's giving lot of pause. They're trying to say the word but it is not coming out, or single word is repeated many times and then only it is delivered as a speech. So these kind of symptoms can be identified much early at 4 years of age itself. Sometimes it is called as normal non-fluency in case the child can come out of this problem by 5 years of age. In case the child cannot come out of this problem by 5 years of age, it has to be assessed by a speech therapist and addressed by a speech therapist as a treatment part. So, what kind of treatments are available for a 5 year of child? So, for a 5 year old child, we can do breathing exercises, oromotor skill exercises, changing the way they speak. These techniques can change the whole neural system and recording of the speech skills. So at much earlier stage itself, he will be changing his speech pattern so that the stammering can be avoided or stuttering can be avoided at much earlier stages. In case this sustains for such longer time, till 12 years, 14 years or 18 years, then what happens, this becomes re-recorded and re-recorded in the brain. That becomes a neurogenic stuttering as such. See, stutterings can be due to genetical issues or just an imitation issue. So, if at all it is genetic, yes, we understand that the techniques only can help. But in case the child got it as an acquired habit by looking at somebody or by imitating somebody, this can be completely deleted or treated, and it can be subconsciously also treated by the child to the child to give a good confidence for him to speak so that he doesn't need to use any techniques. In case this stuttering becomes a neurogenic stuttering, then they need to use the techniques lifelong, because once the technique is used and the stuttering is recovered and he is treated and he is able to talk fluently, then after a certain time, around 6 months or 2 years later, it might reoccur again. So then again he needs to get treated and again new techniques has to be implemented. But in case this stuttering problem is identified and treated early, these reoccurrences and retreating can be avoided as early as possible, and it can be treated permanently. So do not think that stuttering cannot be treated or no techniques can be helpful. Seek your speech therapist as early as possible and get it treated as fast as possible.